So the purpose of this whole movement is to address two problems. Two problems we've got in the healthcare delivery system. Jonathan talked about both of them. One of them is the number of people who have no insurance. In the case of Arizona, it's roughly 20%. We've got 6 million and change people here. 20% of them, 22% of them, varies, have no insurance. We're one of the top states in the country with people without health insurance. So that if the proposal does not address that number of uninsured people, if it does not put us on the road to universality, it's unacceptable. It should be unacceptable. The second issue is cost. If there's not something in the proposal that's very clear to you that it in fact addresses the issue of cost, then it should be unacceptable. We've got to do both of those things. Let me just give you an example. You know, as much as we all love Senator Ted Kennedy, I'm afraid that his proposal is going to be a duplication of the Massachusetts plan, which has been going on now for 2 or 3 or 4 years. But in my view, it's not working. And the reason it's not working is it doesn't address the cost issue. The culprits that Jonathan talked about in terms of driving the cost are still in the mix in Massachusetts. And in my view, that's the reason why costs are not being addressed. So much for the two issues. Let me first also say that I think that a national plan, Conyers is also my favorite, would be far superior to a state plan. And when I started doing this 4 or 5 years ago, we didn't have President Obama. And the likelihood of having anything done at the national level was pretty darn remote. So when I started out, I've been a member of, although I'm not a physician, I've been a member of Physicians for a National Health Plan for years and years. When I first started out with this, I called them up and I said, who around the country has the best state-level approach to a single-payer system? And they said, New Mexico. They've been working on it for years and years and years. Don't have it passed, but they've got it refined because they've been working on it so hard. So I called New Mexico and they said, take it, do it with it, whatever you want. So essentially what I'm proposing, what I've been proposing, and we've got some handouts outside, is what they have done. Mine is slightly different than Conyers in that it's a legislative proposal. So the legislature and the executive branch are still included in my proposal. What I essentially propose is that we create a 15-member commission who will operate the health system and redistribute the money that's in the system now. All the money that we are paying out of our pockets in co-pays, out of our pockets for premiums, what employers are paying for their employees, etc. Because if you add all that up, for the state of Arizona, it's $30 billion. And much like Jonathan talked about at the national level, we can provide health care for everybody in this state for $30 billion, I'm convinced of it. So this commission would collect that money, pay it out based on contracts for doctors, for clinics, for hospitals. My proposal doesn't include global budgeting for hospitals, but you could do that. But this commission, for those of you who are familiar with how the Board of Regents operates in the state of Arizona, we have a Board of Regents that runs a university system. They take money from the state, they take money from lots of other sources, and they operate the university system. What I'm proposing in the commission is similar to that. It would be these 15 people operating. This commission would have 4 years to develop a very specific plan. Because as you can imagine, if you want to roll in Medicaid, or if you want to roll in Medicare, or if you want to roll in the Indian Health Service, or if you want to roll in the VA, those are relationships, and those are contracts, and those are things that would require some time to be worked out. But the intent would be to cover everybody in the state of Arizona. If you live here, you get covered. Another way to think about this is for those of you who have Medicare, it would be like having a state-level Medicare. For those of you who are closer to working age and remember how your employer provided you health care, well, you can think of this commission as being the employer and arranging for health care for you as a resident of the state. The benefit package would be essentially what our state employees have now, which ain't a Cadillac, but it's also not too shabby. Something moderate. It would change drastically the role of the insurance companies. And when I first rolled this out several years ago, I went to Blue Cross Blue Shield, and I was in there with about 50 employees. And let me tell you, that was a tough room. They wanted to string me up. Because, as Jonathan said, and I'll repeat it, because it's very important, because people say, well, how can you do this? What are you going to cut out? Are you going to close hospitals? Are you going to shut down clinics? And the answer to that is no. So then the question becomes, well, where do you get the savings? Because whether it's my single-payer proposal or whether it's Conyers' single-payer proposal, all of the research that's been done on them reaches the same conclusion. It's the only approach of all of the possibilities, Massachusetts, Hawaii, Illinois for kids, it's the only approach that moderates the rate at which costs are increasing. Not going to cut costs. Not going to cut costs. Because health economists all agree, most of them agree, that the thing that's really driving costs is high-tech medicine. Are we going to give that up? Well, no. I got 4 stents. I don't want to give up high-tech medicine. You know, might have saved my life. So the way you save money is to wring out the administrative costs, the marketing costs, the CEO costs, which Jonathan's slide showed, I think, at about 25%. Mm-hmm. That's where you get the savings. And it's not in less care, fewer providers. That's where you get the savings. Needless to say, much like the Conyers bill, the insurance industry, organized medicine, the hospital industry, they don't talk to me about this because they don't like it. Not only do they not like it, they work hard against it, and that's why my proposal hasn't gotten very far. I've introduced it, I think, 4 years. It's my 4th year now. It has had one hearing. I'm less concerned about that because now we have a different person in the White House, and we have the Conyers proposal, and something is going to happen. I'm convinced of it. Something is going to happen this time. And I've been in this business for almost 30 years, and I'm more excited now than I have been in a long time, because I'd sure like to see something get done before I leave this planet. Because it's just been so long.